day, viewers. You're on to your favorite show on TV, the Everyday Living Show. And I'm your host, Amina Adams. I'm not alone. I've got my sisters with me. I've got Hamida Adedoyin.
It's good to be here once again, viewers.
I've got Saida Ojulari.
Peace be unto you.
And of course, Sakina Falan Olanrewaju.
Hello, everybody.
Today on the show, we'll be talking about pre- and antenatal care. I know that by now you're calling your mothers and your sisters and aunts to get seated because they're going to benefit a lot from this. Okay, let's bring on our guest. She's an expert in the field of obstetrics and gynecologist. I'm sure that our sisters are dying to learn from her. Don't go away. Welcome back. We have with us in the studio a medical doctor, specialist in the area of obstetrics and gynecology. She's none other than Dr. Hidaya Durojaye.
Thank you very much.
It's such a pleasure to have you with us.
Thank you.
I know it was such a short notice, but you honored us, and that's remarkable. Maybe because we are female and you know that we need this more than anything.
Very true, very true.
Before you came in, we were chit-chatting about prenatal, antenatal, but we are lost. I mean, we have a lot of JJCs in the house.
Like you also.
But we have an guru expert. Been there, done it. So let's hear from the scientific perspective.
Okay. Prenatal care is caregiving to a woman who desires pregnancy. So prenatal care is caregiving to a woman before she gets pregnant.
Okay.
Well, antenatal care is caregiving to a woman when she is pregnant until her delivery. So that's the difference between prenatal and antenatal care.
Okay.
Yes. So prenatal care is given to women who are trying to get pregnant. And prenatal care is very important for women who have maybe chronic medical conditions, those who are hypertensive, diabetic, who have asthma, sickle cell disease, or those who have had any form of condition prior to desire for getting pregnant, because they must be in optimal health before getting pregnant. Also, women who have had maybe gynecological surgeries for one reason or the other, and also people who may have had cancer treatment, because cancer treatment, hormones of pregnancy can worsen cancer, certain types of cancer. So those should have prenatal care. And then if you're on any medication for long periods of time, maybe there's some people who have some psychological condition, maybe psychiatry, and they're taking some drugs. Those drugs could affect pregnancy. So you must have care before you get pregnant at all.
Wow. That's so much to take in. So let's go back to prenatal. You did say something about some gynae. Specifically, can you mention one or two?
Okay, those who have had maybe fibroid surgeries.
Okay.
So those are some of them. And maybe they've had an ovarian cyst. Appendix, not so much. Except it maybe was complicated. Yes, but appendix is not really related to gynae. They are just the organs are just close to one another. Yes. So if you've had any surgery of any form, especially gynecologic surgery, yes, then you should have prenatal care before getting pregnant.
Okay, so when should this start? When the person has seen a man, or when she thinks she wants to meet a man? When really?
Okay, no, prenatal care should be when you're married. You have a couple. The facilities or the social support is there in preparation for a pregnancy. So that's when you should have prenatal care. Like if you have hypertension, for example, you should have your blood pressure will be monitored with whoever is the doctor that is taking care of the hypertension. It must be in a stable state, and everything should be optimal for pregnancy to take place, because pregnancy has its own challenges, and you don't want to weigh that on a body that is already stressed out. So you want to make sure everything is optimal for pregnancy to take place.
This prenatal care, you did say that so from the day they get married, once they've got married, should they start, or is it a one-off and then months on, then it can just disappear?
Like I mentioned earlier, it's for people who may have had a form of medical condition, or who have had gynae surgeries, or had cancer treatment, or maybe they've had a previously difficult pregnancy. So it's not just
anyone trying to get pregnant.
Yes, exactly, when you're trying to get pregnant. And this is the time where the doctors are like to tell you start taking your folic acid.
Okay.
You know, that's when it's before you get pregnant at all, because folic acid has been found to reduce some congenital abnormalities in the baby. And usually those congenital abnormalities happen in the first 3 months of pregnancy. So it's better you start taking your folic acid before the pregnancy. So you have it at a very good level in the body, and the effect will be felt. So it should be taken before pregnancy. So that's why that takes place.
Hamida?
Well, my own question is what causes miscarriages in pregnancy? Because we know at some stages we have the 3 months, we have the 5 months, we even have the 8 months. So what could have been the cause of these miscarriages?
For miscarriages, that's one of the reasons why prenatal care is there. For example, someone who has diabetes is at risk of having miscarriages. Someone who has sickle cell anemia, because when blood level is low, it may not be able to take on the stress of pregnancy. And once the body is stressed, it tries to get rid of any foreign body, trying to protect itself, which the pregnancy will be. So it's one of the reasons, especially for people who have had miscarriages, they are also candidates for prenatal care, because this helps the doctor to find what the cause may be. But the truth of the matter is, most miscarriages, the cause is still unknown. And then chromosomal abnormalities, that's when the pregnancy doesn't form well. It's one of the things that are associated with miscarriages. So it's difficult to say. But when you have a history or a past experience of recurrent miscarriages, then you should have prenatal care as well, because it may help the doctor find what the cause of the miscarriages. If the doctor is able to identify, then you can treat and make the patient optimal before pregnancy occurs. And the pregnancy will now have a higher chance of being kept in staying till term.
Saida looked so keen, her like you want to swallow everything she's
Honestly,
saying.
if only it was possible. But I think something that's just been running through my mind as you've been talking, so the prenatal care is for people with some certain medical histories, right?
Yes. Yes.
So for someone who might not necessarily have like medical history that kind of conforms to requiring prenatal care, what are some of those things that they should consider before getting pregnant? What are some considerations that they might need to make in their lifestyles, food choices, even possibly before going into marriage? Is pregnancy something that a woman should be thinking about, the optimal, pregnancy for her, I should say? Okay, so food, lifestyle, medical considerations, before, after marriage, etc.
Thank you for that question. That's a good one. For any woman who is considering, of course, and most women in Africa are considering getting pregnant, you should try and keep a healthy lifestyle, drinking, smoking, and then have a decent diet. And it's very common nowadays that people tend to eat out a lot, and that's not very good, because when you eat out, you're taking, most of diets are salted, seasoned a lot and all that. So when you're trying to get pregnant, the important thing is moderation. Try and be moderate in everything you eat. Don't binge, so to say. Ice cream, eating out, I'm having a busy lifestyle, because all those things cause stress. And they may make getting pregnant a bit difficult. Yes, so you need to be in optimal health. And then when you're close to, maybe have a partner already and plan to get married, then folic acid, it's a good one. You can start taking when you're trying to get pregnant. The another important thing is tetanus toxoid, for example. Ideally, women of reproductive age group should have their 5 doses, which gives them a lifetime immunity to tetanus. But when you're thinking of getting pregnant, you can as well start taking them, because once you're able to take your 5 doses, you have lifetime immunity, and that will be it. So those are things a woman can do. And then if you're overweight and you're having maybe irregular menses, it's ideal to lose weight, because obesity may affect pregnancy, and women who are obese are at high risk of having some conditions complicating pregnancy.
Okay, sorry, I'm coming in. You actually wanted to say something. I'm sorry. You actually said something on, if you're fat, you have a longer period of menstruating. So what's the maximum date for menstruation? Because okay, let me be myself. I do the 8 days of menstruation. So is it, with my own stature, what will you say on that?
The more important thing is that as it affects your menstrual cycle. If you're obese and you're having a regular menstrual cycle, it's not likely. And if you're underweight and you're having a regular menstrual cycle, it's very likely that you won't have any issues.
I'm sorry, I didn't pick that. Is it being overweight and irregular, or you have a regular weight and irregular?
Okay.
I was mixing up the regular and irregular.
Okay. It's the irregular menstrual cycle that's the problem. So whether you're overweight or underweight and you have a regular menstrual cycle, then you're good to go. Or when you're having irregular menstrual cycles, it may be affected. Maybe the cause of the irregularity may be your weight. Because there's a certain weight, I think about 50 kilograms for menstruation to effectively take place. And the regular menstrual cycle suggests that you are ovulating regularly.
So what's the maximum days for menstruating?
Not more than 7 days. Ideally, it's the normal range is between 2 and 7 days, so not less than 2 and not greater than 7. But if what you have is what you have always had, then it might not be so much of a cost to worry. Yes, except maybe there's some maybe stresses and things like that. Who knows what, the hormone system is quite delicate and many things could alter it. It may be non-pathological, that means from nothing, actually just how your body is, or it could be from a disease condition that you may not know that is there, but it's there and it's not bothering you right now. So it won't be an issue for you getting pregnant.
Okay, so enough of prenatal, let's go to antenatal. Very quickly, at what point should women enroll for antenatal classes? Are there people that do not go for these classes and they still, make it? Is it possible to do antenatal on your own because you simply can't afford the hospital bills? Just let's talk more about antenatal.
Yes, that's a very good question. When a woman is trying to get pregnant and she misses her period, that's the first thing to do is do a pregnancy test. And that could be done by a urine test, which you can do at home. There are a lot of home kits now. And then a blood test, which can be done in a laboratory. So the good thing is once the pregnancy is confirmed, i.e. the pregnancy test is positive, and the next thing for you to do is you plan to do an ultrasound scan. And that should be done between 7 weeks to 12 weeks from your last menstrual period. Now this ultrasound scan has 2 major benefits. One is that it confirms that you're pregnant, and then you can also date the pregnancy that early from your missed period, So like if you miss your period maybe like 4 weeks, as in you're expecting your next period 4 weeks, and then you missed your period, so you can give it a week or 2, and then you do a pregnancy test. Even though there are pregnancy test kits now that can tell you you're pregnant before you even miss your period. But once maybe you missed your period and you're trying to get pregnant, a week or 2, do a pregnancy test, and then within 4 weeks go for an ultrasound scan. The ultrasound scan, as I said, will help you date your pregnancy, and as well it will also help us locate the pregnancy, because we know that pregnancies can form outside the womb, at the uterus. Yes, that's what ectopic pregnancy. Yes, like you mentioned. Pregnancy can also be formed outside the womb, and that is ectopic pregnancy, and this can be life-threatening. So it's something that is very important. So it's better when the pregnancy is well formed, you are rest assured. And then you also have the added benefit of having, it will help you date your pregnancy as well. So for people who have irregular menstrual cycle, maybe who were breastfeeding and somehow got pregnant, so they don't know when their last menstrual period was, or they were using a form of contraception that maybe they didn't work or they didn't use it well, and they accidentally get pregnant, they won't be able to tell exactly when their last menstrual period was. So it's very important for those group of people, as well as that detect ectopic pregnancy if it occurs early. Because if ectopic pregnancy occurs and then it bursts, because if it's outside, if it's outside the lining of the womb, wherever it is, it could burst. Yes, ectopic pregnancy forms outside the womb. And when it's not in the womb, if it's pregnancy, it's supposed to grow. As it grows, if it's somewhere that's not supposed to be, it could burst. And because, pregnancy is supported by blood vessels and all that. So once it bursts, it means you have a leaking blood vessel.
Whoa.
The woman starts bleeding. Yeah, so you have people having fainting attacks and things like that.
Okay.
It's actually life-threatening when it bursts. So it's very important. So that's why it's very important to have an ultrasound scan. So you can be sure that pregnancy is where it's supposed to be, and then you can go on with your life. Because if it's an ectopic, it's an emergency really. You have to go straight to the hospital to see a doctor.
Okay.
Now, talking about Boston, so is there everyone that is susceptible to this ectopic pregnancy, or what causes ectopic, and can it be cured?
Ectopic pregnancy, well, the cure when it bursts is surgery. But if it's found before it bursts, you can have some form of medical treatment.
Okay.
So that the pregnancy is aborted, so it doesn't have to burst. But the treatment when it bursts is surgery. You have to have surgery as soon as possible. That's the only thing that will save the life of that woman. And the causes for ectopic pregnancy, the cause for ectopic pregnancy is damage to the fallopian tubes. That's the tube in which fertilization takes place. So once there's a damage and the fertilized egg can't move into the uterus to implant, that's to stay in the womb, then it stays outside. So things that damage the tubes, which could, in our environment, the commonest cause is pelvic inflammatory disease. That's when you have, it's a gynecological infection in which the genital tract is infected. And there's some adhesion that's like sticking up or roughing up of the anatomy of the tube. So anything that causes that, would make you at risk of having ectopic pregnancy.
Now I'm scared.
So, but that disease you mentioned, is there a cause, or it can happen to anyone?
Well, the people at risk of having pelvic inflammatory disease are those who have had, maybe who are sexually active and have had a form of infection or the other, who are not taking good care of themselves. Or when you have such an infection, which is characterized by vaginal discharge, low abdominal pain, and fever. So if you have those and it's not well treated, then that could be a risk factor for ectopic pregnancy. The reason why it's common in our environment now is because women have infections and then they do self-medication, they take some drugs and they don't treat properly, and the infection thrives and continues with the damage. And the commonest organism is such that you might not even overtly have symptoms, and it just goes on for so long. So taking antibiotics indiscriminately may let such infections go on for so long. So if you're going to take antibiotics, it's better it's prescribed, and then you complete it for the period that was prescribed for. You don't stop in between, because a lot of us are guilty.
Yeah, I do that a lot. I am guilty.
Okay. I remember you mentioned taking a scan, doing a scan when you're about 8 to 12 weeks when you're pregnant. If before you were pregnant, you had been taking some supplements like the B12, folic acid, and maybe you're anemic, so you've always been on iron pills, then you get pregnant. Can you continue with that dosage, with those multivitamins, or are you supposed to go and see a gynae immediately?
Okay. When you're taking, if they're multivitamins, then it's fine. You can continue those even when you get pregnant, because you usually need multivitamins during pregnancy, because it helps optimize the system for the fetus. That's the baby that's growing.
Okay.
Yes, so your multivitamins are good. You can continue that.
Okay, I've always had one question that I discuss with people, especially, obviously, females. So for a pregnant woman, what does her diet need to consist of? Because we see a lot of women that binge, and during pregnancy they binge, they gain a lot of weight, a lot of unnecessary weight they don't really have to gain.
Yeah, that's common.
And then also after breastfeeding, they say that period is your weight, that's a good time to lose weight, and afterwards you have to be careful to not pack it on again. So while pregnant, what are those required vitamins and that required diet? Or does everyone have to stuff their face and just become like 50 kilos?
They eat more when you're
heavier?
pregnant.
The thing about that is that it's not for everybody. Some people have challenges eating while they're pregnant. Binging comes from some of the hormones that are produced in pregnancy, and it's more psychological than really hunger. Not like you're hungry. It's just how you feel, and you find comfort in eating. And the best advice, like I said, is moderation. Try and be moderate in everything. Eat a balanced diet, because you know you're having a fetus who is growing, and all the supply the fetus has is from you, the mom. So you have to eat something that's balanced to make sure that you're giving the baby vitamins and minerals, you know, which you get from vegetables and fruits, and then eating well. So the ideal thing is eat well. When you're pregnant, you should gain weight, because yes, you should gain weight to accommodate pregnancy. So there's some amount of weight gain, and depending on what weight category you are, those who are slimmer will gain more than those who are on the bigger side. They should gain less, yes. So when binging is usually in a phase, really. Over time it goes away, and then, well, you know, you just, you know, most times people binge because their appetite is not so good. So when they find one thing they do want to eat, then they eat a lot of it. So, but the ideal thing is try and find moderation. Eat your fruits and vegetables.
What about cashew nuts?
Cashew nuts are good. Cashew nuts are good. But the important thing is excess of anything is bad for you. Well, except maybe water.
You have to take the
Yes, good water. A lot of water helps, you know. So that. But
for clarity.
I'm sure if we let you go, you keep going on and on and on. Let's go to Dr. Antenatal, wrap it up. Give us pinpoint what we need to do and what we need to look out for.
Antenatal care, as I said, is caregiving to a pregnant woman during pregnancy. And like I think I heard someone say earlier that it's in 3 trimesters. A trimester means 3 months, and we know pregnancy is for 9 months. So you have the first trimester, the first 3 months, the middle trimester, the second trimester, the second 3 months, and the third trimester, the last 3 months. In our environment in Nigeria, for example, people don't go for antenatal care early, and this is wrong. Once you find out you're pregnant, you should seek care for your pregnancy, because the challenges that come with pregnancy, and once you're seeing someone, the person can help you through pregnancy. So you go, they talk to you, ask you about questions, educate you about pregnancy, and it's also good for women to read about pregnancy, because when you've read, you can ask questions and you get answers. And then the first trimester is when the pregnancy develops, when all the organs are developed. So usually at the end of the first trimester, the pregnancy, it's a human being, more or less. All the organs, the eyes, ears, nose, the limbs, everything is there. Yes.
Oh, really?
And then the second and third trimester is growth of the pregnancy. So the earlier you go for antenatal, the better. But it's never too late also to go for antenatal care. And when you're doing your antenatal, the things you do is you want to identify where you will have your antenatal care and who is going to take your delivery. So if you've had like conditions in the past, then you should be seeing a specialist who can manage your pregnancy with the special conditions. People who are getting pregnant for the first time should also have, should also go to the hospital and be managed for pregnancy, because there are challenges that could come up all the way, and you have general advice on what to do. There are things to do like immunization. The tetanus toxoid I talked about is part of the antenatal care, and then prevention of malaria in pregnancy, because malaria is a big deal in pregnancy. So you have treatment for that at intervals in pregnancy. And then your medications, the multivitamins like she mentioned. More importantly, the iron supplements and folic acid. Those are the 2 more important vitamins in pregnancy. So you'll be given that. And then they monitor you as pregnancy progresses. Is the baby growing well? Is the baby well positioned? They listen to the heartbeat, give you general advice, get you prepared for labor, for example, advise you on things you need to get, in as far as the baby is coming, and they make you prepared for the birth. Birth preparedness, that's what's been talked about now. So it helps you get ready for the pregnancy, and then you go along. So when you read, you have questions, you can ask, things can be clarified, if you have complaints, because some complaints might seem minor, not important. But when you tell the doctor, it may be more important than you think it is. So it's very important to have antenatal care. And antenatal care is for all women. It doesn't matter whether you should have your pregnancy cared for. Somebody should be responsible for taking care of you during pregnancy, during the delivery process, and then thereafter you should have care during pregnancy. So it's very important, antenatal care. And towards the end of pregnancy, the delivery will be talked about, getting you prepared for the process of delivery, which could be a normal delivery or a cesarean section, whatever the case may be. Most people would have a vaginal delivery, that's the normal delivery, and some people will have a cesarean section. The choice is mostly for the doctor, and they have reasons to choose, to have for you to have a cesarean section, for example. So that will be discussed with your gynecologist. So the important thing is have someone who is responsible for your care during that pregnancy, because it's painful for a woman to get pregnant and then lose the baby or lose her life. Those are very big deal. Those are challenges for an obstetrician, because you want to make sure that you have a healthy mother and a happy baby at the end of the day, and that's what's most important for any obstetrician.
Thank you very much for coming.
You're welcome. It's been a pleasure.
It's been a pleasure having you with us. It has been educating. I've learned so much. We're all women, and I'm sure there are tons of women out there that have picked up one or two things. We'll be calling you back on the show because there's never an end to learning, and we do hope that you'll have the opportunity to come back with us. This is where we say goodbye to Dr. Durojai. She needs to get back to her patients. Her family is waiting. Don't go away. We're still on the show.
How are you doing, people? I'm Hamida Oyebuchi-Wosu, and this is the quiz segment of Everyday Living. Today's riddle is, how many times do you take out the number 2 from the number 50? I'll go again. How many times do you take out the number 2 from the number 50? If you know the answer, email us at everydayliving@gmail.com or follow us on any of the social media platforms displayed on your screen. It's your choice. Adios.
Welcome back. I knew it just before we went. I thought I was going to get away with it this time, but still no. One day I'll get it. Her riddles, her questions are just out of this world. Anyway, stereotype busting. Ha. Okay.
So this is something that I hope you guys would have some experience with.
Okay.
But there's like this huge stereotype that Asians, both Far East and like around India and stuff, that they have like really high IQs, like they're breeding geniuses.
There she goes.
No, seriously, I can tolerate the Japanese with all their technology and all that.
Yeah, so
maybe Chinese.
Yeah. So you do have that stereotype.
No, yes.
I think
it's a stereotype. See, at uni, I had a friend that she's from Singapore, and she had a lot of Chinese friends, and they paid people to write their exams for them. So I mean, yeah, they're all getting A's and everything, but they weren't writing their exams and they weren't writing their own papers. So
and I guess it was easy to get away with because they all look alike.
That was another stereotype.
So it was easy to impersonate one another during the exam.
They don't all look alike. You're shocked at how they'll detect
how
them.
different, exactly.
Hamida, you have something for us?
My stereotype goes, all men love blue colors.
I think it's true. Oh, no, not quite. There's a guy, didn't we meet a guy that loves all pink?
His whole
Pink room?
Yeah.
Pink
And
curtains.
my color is I love blue. That's my best color, and I'm not a man. So.
Oh, because you're blue.
There's another man that loves pink.
Complete,
No, I mean, but a woman can get away with blue. Come on, there are different shades of blue. But there's no shade of pink. That's for a man. Come on.
Girls love pink. I love pink on a guy. I really like pink on guys.
No, but he
like
won't.
ties.
You are the one loving it.
I do too, seriously.
No, you're the one loving it, but he shouldn't be the one wanting it and having pink curtains, pink bed sheets.
He could pass
Pink
in any
towels,
shirt.
pink.
He could buy, but definitely not pink pants. You know?
But guys on blue looks very good.
Okay, so
that's
it's okay,
a male
we're
color.
stereotype anyway. That's how we end the show today. It's always a high note when we end the show with this stereotype busting. Join us same time next week when we bring you another bumper package of your favorite show on TV. series, The Everyday Living. Until then, peace be unto you.